I'm a comprehensive ophthalmologist with a particular interest in childhood and paediatric eye problems. I also am a bit of a strange beast. I do adult glaucoma as well and treat adult glaucoma, and where childhood problems and glaucoma overlap, I also get involved. Currently I've got appointments at the Royal Children's Hospital in Melbourne and the Eye and Ear Hospital in Melbourne, and I work in private practice at Parkville Eye Specialists. I've just presented a seminar this morning on common children's eye problems. The common eye problems in children including detecting strabismus or squint, amblyopia or lazy eyes, and I think the key take-home messages from this are not to ignore a constant squint in a child, but to refer them on for assessment. Intermittent squints should always be referred after the age of 6 months. Also, I emphasise the importance of screening children's vision and assessing them for lazy eye or amblyopia, especially when they become verbal around the age of 3. I think some of the exciting things in paediatric eye health are spilling over from recent developments in adult eye care. The use of intraocular lenses in childhood cataract is very specialised and something that's exciting and hopefully improving outcomes in childhood cataract. We use lasers in cataract surgery in adults now, and I think in the next 5 or 10 years it has the chance of improving the cataract outcomes in children. And then there are important areas of squint that we've learnt that earlier management of large angle turns in young children is very important. So assessing them and operating under the age of 1 is very important for our infantile or early onset convergent squint. I think there's exciting developments in my ability to monitor glaucoma in children, use of the rebound tonometer, which doesn't need anaesthetic, makes my life a lot easier to measure children's eye pressure. And I think screening and monitoring children is just so important to check their vision, and to always prescribe spectacles, and patching is a well-known and tried and true method of improving children's vision, and something that we just need to reiterate the importance of. I think the GPCE has been a great platform for GPs and practice nurses to get more knowledge in lots of areas that are quite specialised, and hopefully to have that information shared in a very easily accessible manner, with a great format of many workshops where it's very hands-on and lots of opportunity to ask questions. In my specific area, we've had a group of speakers, all volunteers from the Australian New Zealand College of Ophthalmology, and I think the very practical sessions on children's eye problems, on red eye problems, and on vision loss should stand GPs and their teams in great, give them a great basis to treat these things in general practice.